Hi, my name is Sarah Ree, and the toxic chemical I chose is 1,4-dioxane. I chose to do my presentation on this chemical because I've heard that the groundwater beneath the city of Ann Arbor is currently contaminated by 1,4-dioxane. So basically what happened was back in 1980s, a company named Paul Life Sciences used it as their industrial solvent. But when they were disposing this wastewater, they sprayed it over their lawns, and now this chemical is seeped through soil, rocks, and even into groundwater. There have been several efforts to remove this chemical out of groundwater. However, this still remains as a challenge to a city of Ann Arbor, and I believe this is something that we should be definitely aware of as a resident. So what is 1,4-dioxane? It has several names, which includes diethylene ether, 1,4-diethylene dioxide, and its molecular name is C4H8O2. As you can see on the slide, it's basically a 4-carbon ring connected by 2 oxygens in the middle. It's a colorless liquid with ether-like scent. When it's in the air, it oxidizes and forms something like peroxide, and it quickly degrades. It has a boiling point of 101 Celsius and melting point of 11 Celsius. With this, we can tell that it is really hard to extract this chemical out of water without evaporating water itself, and also with a little bit higher melting point, we can definitely conclude that it is easily miscible in water, ethanol, and ether. And also, it is known to be highly mobile in soil, so it has a higher or longer half-life in soil and ground. So let's take a look at how this chemical is used. 1,4-dioxane is generated from a breast carcinogen, ethylene oxide, through a process called ethoxylation. Basically, ethoxylation is to make other chemicals less harsh. So it is used in many productions of cosmetic raw materials and cosmetic finished products. And from a study conducted by U.S. Food and Drug Administration, it was found out that this chemical was in about 97% of hair relaxers like shampoo, and 57% of baby soaps, and 22% of all skin products. Along with that, it's also used for many other industrial purposes, such as stabilizer for solvent 1,1,1 trichloroethane, and it serves as a solvent for cellulosic organic products, paints, and oils, and more. So how are we exposed to 1,4-dioxane? As we've seen in the previous slide, we use shampoo, food packagings, and a lot of skin products on daily basis. So the easiest way to be exposed by it is through thermal exposure. However, if it is present in the air, we can be also exposed to it by inhalation and also ingestion. There have been many studies conducted on animals to see its adverse health effects, and a lot of animals have shown symptoms like irritation of skin, respiratory failure, liver and kidney injuries. And also in humans, when exposed to this chemical, people have shown symptoms like vomiting, nausea, irritation of eyes, nose, and throat. And after like acute exposure, liver and kidney diseases and even deaths were also observed. EPA um, set this chemical as probable human carcinogen because through many animal testings, they have found out that it causes cancer in them, like such as nasal cavity carcinomas and liver gallbladder carcinomas. However, they do not have enough data to prove that it can also cause cancers in humans. So there is one known mechanism of 1,4-dioxane that becomes toxic and carcinogenic in our body. So normally when we are exposed to 1,4-dioxane, our body goes through a metabolism to convert it to a chemical called HEAA, so that our body can excrete it out through urine and our other excretion methods. However, when we're exposed to a high dose of 1,4-dioxane, due to a limited capacity of our body to convert it to HEAA, it takes on to alternate pathway of hydroxylation and oxidation, which ends up producing something called HEA. HEA is reactive metabolic that is responsible of toxic and carcinogenic expression of 1,4-dioxane. So when we are exposed to a high dose of 1,4-dioxane, our body ends up producing this metabolic compound which can become toxic and causes cancer in through many different ways. I read this one scientific paper called On Updated Evaluation of Carcinogenic Potential of 1,4-dioxane. This basically summarizes any previous studies that have been performed to check carcinogenic potential of 1,4-dioxane. So it was really helpful in ways to understand the risk and how those risks were identified through many different studies. This paper summarized all the studies into 4 categories: cancer bioassay data, epidemiological data, and pharmacokinetics and dose response assessment. So out of many studies that were summarized and explained on in this paper, I took a special look at epidemiological studies. And one of them was conducted in 1976 as a cross-sectional study in Germany. So basically, they examined and followed up with 74 industrial workers who were exposed to 1,4-dioxane. In the end, there was really no evidence of liver or kidney damage that had been seen. However, 12 workers were reported dead, and 2 of them had cancers as their main reasons of death. Those 2 cancers were epithelial carcinoma and leukemia, which weren't seen in any of the animal testings. Along with that, the death rate and cancer occurrence were not significant, especially since when the study size was so small. However, overall data and its long-term effects were predominantly negative, so it indicates a potential of 1,4-dioxane causing cancers and any negative clinical symptoms in human bodies. With this backgrounds on 1,4-dioxane being toxic and potentially carcinogenic, we should be also aware of how to prevent this chemical from causing adverse health effects. Apparently, there's no current regulation requiring inclusion of 1,4-dioxane on product labels. However, a lot of scholars and Department of Public Health recommends consumers to avoid buying products with chemicals ending with eth or oxynol or any byproducts of ethoxylation. Also, it has been studied that and proven that any products made out of organic substances did not contain any 1,4-dioxane. So it will be a good way to purchase products with USDA National Organic Program certification, just to make sure that there was no 1,4-dioxane contaminations. In industry, there's definitely some alternate process to replace ethoxylation, which includes using organic substances and vacuum stripping, which is used to remove any 1,4-dioxane out of products. And luckily, one company called Johnson & Johnson, which is famous for its baby products, announced it that they will not use ethoxylation, but rather use any alternative ways to avoid potential contamination by 1,4-dioxane, which is a really great news. This is all I have prepared for my presentation, and I hope you find this information helpful, and I hope you enjoyed my presentation. Thank you for listening.